Good evening and welcome to tonight's webinar on reducing pain and how to avoid surgery with non-surgical treatments for orthopedic conditions. My name is Russell Burgum. I'm the physician at the Regenexx Des Moines Clinic, and thank you all for joining me here tonight. And as we go along, I hope to open your eyes and shed light on regenerative medicine treatments for orthopedic conditions. That's what we specialize at here in Regenexx Des Moines. And we should have time for a question and answer session at the end. So take notes if you want. And this is being recorded and will be available online through the Regenexx website. So my area of specialty, and anyone working in a Regenexx clinic, is called interventional orthobiologics. That's a kind of a mouthful, but interventional orthobiologics stems from interventional orthopedics, which is the specialty of using high resolution guided technologies such as ultrasound or fluoroscopy, which is a real-time X-ray type system, to guide needles into specific locations throughout the body. And so that's the interventional aspect. Interventional orthopedics refers to doing these types of procedures on for orthopedic conditions, and that broader term kind of would include doing things such as steroid injections or in our case, platelet-rich plasma injections or bone marrow concentrate extract injections. And so that's where the orthobiologics terminology comes into play. Ortho meaning orthopedic, and biologics meaning using the patient's own cells and tissues. So that's what we do. We do not do traditional steroid injections. All of our procedures at any Regenexx clinic would use ultrasound technology, such as what you can see on the left picture there, or fluoroscopic X-ray, real-time X-ray procedures. And that's what the picture on the right shows. And as I mentioned, I'm a physician with Regenexx, and Regenexx is actually where stem cell injections were started. This dates back to 2005 when the Centeno Schultz Clinic in Broomfield, Colorado, first started using stem cell injections to treat orthopedic conditions. Ever since these procedures began, all Regenexx clinics have been we track all of our procedures to see which procedures and what parts of the body work well and for how long do they work, and with what type of injection technology and product is used. So starting in 2005, whenever a procedure was done, patients would be asked to fill out a baseline survey, asking them questions about their pain level, their function level, what can you do and what can you not do. And after a procedure is done, any type of injection, any type of procedure that we do, patients are asked to fill out subsequent follow-up surveys, more frequently initially, like at 1 month, 3 months, 6 months, 12 months, and then annually for up to 20 years after that. And as a result, well, let me back up. And so the Regenexx network of clinics has expanded to now over 90 clinics, and all of the clinics participate in this patient outcomes registry. So we all and have our information entered into this database, which gives us the world's largest orthopedic outcomes database. So that with that, we can track what works and what doesn't work, and for how long does it work. And we use that to help determine you, the patient, how good of a candidate you are. Meaning, do we think you're going to get great results for a long time, or do we think, maybe you might not get good results at all, and therefore be a poor candidate, in which case we would recommend you actually have surgery, or that you might be a fair candidate, meaning you've got a pretty good chance of getting moderate relief for a moderate amount of time, meaning several years. So that's one thing we pride ourselves on, is making decisions based on data. We assess each patient. Each patient's condition is unique, and come up with a candidacy rating on every patient. And the other thing is, all the procedures that we do and the technologies we use are all verified with numerous research studies showing their efficacy. And so we're not guessing, we're not making things up as we go. It's all science-based and data-driven. So this is the new specialty of interventional orthobiologics that I mentioned. So that there are physicians and clinics, very well-known clinics around the world, that will do these types of procedures, but most are not doing it to the high degree of technical expertise and thoroughness that is done at a Regenexx clinic. So we use injectates that facilitate your body's own innate healing for bone, tendon, ligament, muscle, or cartilage. The Regenexx clinics do not generally do any sort of cosmetic procedures. Like there are procedures where physicians or practitioners can use a patient's own blood and get the platelets from the blood to treat hair loss or wrinkles or even gynecological conditions, but all of our orthopedic conditions, all conditions treated in Regenexx clinics are orthopedic. So we precisely place those injectates into damaged structures using the guidance technologies that I showed you earlier. And we're continually looking at new ways of doing procedures through the skin without having to open up the body with a surgical interventional procedure. It's all percutaneous, meaning through the skin procedures. So again, what is interventional orthobiologics? Well, if you look at what typically happens in most clinics around the world, probably 95%, are just simple injections, often without any type of guidance, where the surgeon or the sports medicine doctor or the physician assistant may just kind of feel around and clean the skin and do an injection. For the most part, they're simple injections where they're going into the joint only, such as into the knee joint or the hip joint or the shoulder joint. And that represents about 95% of the physicians. Now, about 4% of the physicians will do more advanced techniques where you may be addressing some of the other structures outside of the joint, not just the joint itself. And interventional orthobiologics represents about 1% of the physicians, where we use, as I mentioned, the high-tech guidance for all of our injections. We don't just blindly inject into a structure. And when we treat a joint, we treat way more than just the joint surface itself. So we look at a joint as having stability. We looked at, are there problems with the joint being too loose or too tight or unstable? We look at the nerve innervation to that joint. We look at how is that joint related to the joints above and below it. And so, for example, in the diagram above, that's a diagram of the knee, and all these other structures outside of the joint, such as the tendons, the bone itself, the cartilage on the surface of the bone, the shock absorber called the meniscus, the different tendons and ligaments around the joint. These are all structures that I will treat if needed. But in general, when I'm doing a joint injection, I am treating numerous structures, because the issue generally isn't just a problem with there's pain in the joint, there's all the supporting structures around the joint. So like with the shoulder, we don't just inject into a bursa or into the joint itself, we address all the supporting structures. So we perform these precise procedures using, in this case, I'm referring to MSC, which is mesenchymal stem cell / BMAC, that's bone marrow aspirate concentration. That is our main area of for obtaining MSCs, is where we get bone marrow from the back of your pelvis. But we can treat numerous conditions, ranging from headaches, which if they're related to tension in the neck or tension into the muscles, that you can get tension headaches that is treated. So there are orthopedic causes for headaches. If you had a neurologic cause for a headache, such as migraine headaches or brain tumors or other things, that is not something we would deal with. But working from the head down, we can treat neck issues, upper back pain, shoulder issues such as arthritis, rotator cuff tears, elbow ligament injuries, elbow arthritis, wrist arthritis, carpal tunnel syndrome in the wrist, ligament abnormalities called the triangular fibrocartilage complex, that's TFCC, in the wrist, back pain, bulging discs, spinal stenosis, hip arthritis, knee arthritis, meniscus tears, ACL tears, that's the anterior cruciate ligament. These are all things that we use bone marrow concentrate to treat. And then finally down, all the way down to foot and ankle. In my practice, my focus is on extremities. So there's very little spinal procedures that I do. There are injections that I do in the supporting structures around the spine, or in the lumbosacral region called the sacroiliac joints. But all the other joints from your body, from head to toe, are things that I treat routinely. So we're very different from your typical stem cell clinic. There are ads on the internet and on the radio, and it seems like we're inundated with stem cell treatments, and Regenexx clinics all are highly trained physicians. There are no mid-level practitioners doing the procedures or evaluations. All injections are done with ultrasound or fluoroscopy or both. I have many procedures where I use both as I'm doing it. Every Regenexx clinic has a clean room facility lab where the patient's blood or bone marrow is processed precisely in our own lab on site at the same site where you're evaluated and treated, to customize the dosage or the concentration of your platelets or cells that you are getting. It's not a simple centrifuge bedside machine that 95% of all the other clinics use. So what that means is most clinics will say, yes, we do PRP injections. That means platelet-rich plasma injections. And what they'll do is they'll draw your blood. It might not be a very high volume of blood, maybe 5-6 vials of blood. They spin it on a centrifuge and then take that to separate out the layers of your red cells from the white cells from the plasma, and then run that through a kit that you can buy from one of the device manufacturers such as Arthrex, or there's numerous ones out there. And that kit will then kind of process your blood, your plasma, and come up with platelet-rich plasma. And those kits generally provide the same dose to everyone, every patient. So whether you're 30 years old or 80 years old, whether you have mild arthritis or severe arthritis, everyone gets the same dose. And in a Regenexx clinic, every patient's treatment is customized, and we can concentrate those platelets or bone marrow concentrates to a much higher amount in our custom processing in the lab. And we're backed by a multi-million-dollar research facility out at the main facility in Colorado. They do hardcore research on cells and stem cells, and we do studies looking at what things affect the viability of of the patient's cells, what makes the procedures more potent, what medicines you might take might impact your treatments, what dietary changes or dietary supplements can you take to help with your outcomes, and that's all driven by the research lab. And then there's a fellowship program at the Regenexx main clinic in Colorado, where they're training new physicians on an ongoing basis. And I need to update my slide because we have more than 60 sites, and so it's more like over 90 sites now. So here are some examples, more examples of what goes on with interventional orthobiologics. These pictures here show a fluoroscopy guided injection of products, patient's own cell products. If you look in the upper right, that's an X-ray type picture showing a thick needle called a trocar going directly into the patient's patella or kneecap, and that is treating degenerative changes in the joint, in the kneecap itself, from the inside out. So people generally think of arthritis as wear and tear on the surface of the joint, or the cartilage is wearing out. But MRI imaging can show where the bone is actually dying from the inside out. And that's what the picture in the lower right shows. That's an MRI image of showing swelling or bone marrow edema, that bright white area in the kneecap here. That is not normal on this series. The cartilage is underneath here, but this is an area where the bone is dying out, and called the bone marrow lesion. And when we see that, that's a precursor to rapidly advancing arthritis. And there are numerous studies over the last 10, 12 years that show that putting an injection of either concentrated platelets or bone marrow concentrate right into that area can heal that up from the inside out. And then the smaller needle here is showing doing an injection from the outside in, from the cartilage, injecting right onto the surface of the cartilage. Some other examples of orthobiologics, these info there, we have some drawings on the right and actual fluoroscopic images on the left showing how we can inject the bands of the anterior cruciate ligaments, which are one of the two main crucial ligaments on the interior inside of the knee that keeps your tibia, your shin bone, from shifting too far forward on your thigh bone, the femur. So tears of the ACL are treated in our clinics. This shows a treatment of a tear of the superior labrum, called this superior labral anterior tear. This is a fluoroscopy sequence showing injecting the shoulder labrum. So this next picture here, it's kind of hard to visualize. It's a ultrasound imaging of someone's forearm, wrist, I should say, image of the wrist, and with the ultrasound imaging, it looks as if we took a sort of cut the hand off and we're looking at the stump of the forearm. And so it's called a cross-sectional view. And this section here shows the median nerve is the nerve that gives innervation to your thumb and index finger and middle finger. And that's the nerve that gets impinged or flattened or damaged with carpal tunnel syndrome. And so this is one thing that we treat frequently, and this shows an ultrasound procedure injecting growth factors around the median nerve. So on ultrasound, dark is fluid. So this represents fluid that's been injected, and using a tiny, skinny little 30 gauge needle, which is, if you know anyone who's diabetic, that's about how thin the needle is. So carpal tunnel syndrome is an example of using very high-tech ultrasound guidance. So people ask, well, why do you even do this? Well, you know, there's surgery for all of these different conditions. Well, surgery isn't always the best solution. It's more invasive. Patients are laid up for a much longer period of time. Oftentimes you lose parts of your body in surgery, and they cut out, you know, large portions of your knee and replace it with an artificial knee. And so orthobiologics is less invasive. Patients do not have to go under general anesthesia, and you recover quicker. And we have great outcomes because, like I mentioned earlier, all Regenexx clinics track the outcomes of all their procedures. So if you've ever been into another clinic, you may have been into a clinic and a provider may have done a knee injection or a shoulder injection. Now, if that were at a Regenexx clinic, you would be getting surveys every year for 20 years after, asking you, how are you doing? What's your function? Are you still doing well? So we've got good data to show that this works, and you keep your own parts. You preserve your mechanics, the biomechanics of your body, and we've been able to show that it's much more cost effective than surgery. That it's can save you money, or if your employer is has a self-funded insurance plan, your employer can save money by avoiding elective surgeries. Now, there are surgeries you can't avoid. If you fall from a tree and you break your leg and your bone is protruding through your thigh, we're not going to do any type of injection for that. That needs to go to the operating room. But for elective degenerative conditions, the interventional orthopedic and orthobiologic treatments are much less invasive and much more tolerated. So I mentioned before, we've got many advantages to being part of the Regenexx system, Regenexx clinics, and it's all because we have hard science behind it. So what sorts of things do we use? I mean, when we talk about orthobiologics, I mentioned one is growth factor enriched serums. That's where we can get the actual growth factors that are elicited, that are released from platelets when they come into contact with damaged tissue. We can extract those in the lab and inject just those serums. We get bone marrow cells from the back of your pelvis, which has a very small percentage of those cells are mesenchymal stem cells. There are numerous other cells that are very potent promoters of healing, and that we also use, and a large one is concentrated platelets. That's where I mentioned PRP, platelet-rich plasma, and I would say probably 70% of the procedures we do are the concentrated platelet procedures. So platelets are a component of our blood. So when you look at blood, it's, it's red, but if you separate out the layers, you can separate out the layers of the blood with a centrifuge to separate out the red cells from the white cells, and what's left is about 40% of your blood volume is a clear yellow liquid called the plasma. And in the plasma is where the platelets live. And so we separate out the plasma, take all the platelets from a large volume of plasma, get those platelets out, and then reconstitute them or mix them back into a very small volume of plasma. So you have a very high concentration of platelets in the plasma. So some people ask, well, what are these growth factors or cytokines or stem cells? And we think growth factors are, you think of it like more concentrated, it's special shots that kind of kickstart the healing process. And cytokines are natural chemical messengers that tell cells to do things like to come on in and help repair tissues or to neutralize some inflammatory chemicals in a joint, and A2M is one of the ones that we use in Regenexx clinics that it helps get rid of inflammatory products in joints. A2M is a cytokine that is released from platelets. And then stem cells, or MSCs, are our cells. We have stem cells throughout our body, in all of our organs and all of our tissues. There are stem cells that are just kind of sitting around waiting to get called into action when there's trauma or breakdown or degeneration. And in our bone marrow, we have reserves of stem cells. And so when we talk about stem cell treatments, that's what we're referring to, getting them, the mesenchymal stem cells from the bone marrow of you, the patient, or in some instances, getting them from adipose or fat tissue from the patient. If you ever hear ads about stem cell clinics that are offering umbilical cord stem cells or amniotic tissue stem cells or fetal tissue, that none of that pertains to us in Regenexx. That has been proven to be ineffective, which I'll talk about in a little bit. But when we're talking about stem cells, these cells are like general contractors in your body that help to coordinate all the other healing cells in the area to organize how they heal the tissues. So they're very, very potent signaling cells. As a matter of fact, the man who discovered them and named them, Dr. Arnold Kaplan, called them mesenchymal stem cells. And he's years later, after doing more research, he said, I should have named them mesenchymal signaling cells, because they really signal all the other cells in the area to help repair damage. And we think that when the day is done, they might actually turn into actual cartilage or tendon. It's hard to prove that the actual stem cells themselves convert into cartilage, but we know they are amazing promoters of healing. So I've mentioned platelet-rich plasma quite a bit. Platelets are really amazing, tiny little cells. So when you get a cut, your blood comes into contact with collagen or the connective tissue in your skin. That in your blood are platelets, and when platelets come into contact with connective tissue, they release numerous growth factors to help stimulate new cell skin growth, clotting factors to stop bleeding, growth factors for tendon, cartilage, ligament, bone. So they release numerous growth factors when in contact with connective tissue. And one of the great benefits of being in a Regenexx clinic is the fact that I mentioned earlier, is that we can concentrate those platelets or increase the dose, is one way to think of it. It's much higher, way higher than other simple bedside machines that's used all around the country. So why is that important? Well, there are numerous studies that have looked at this to see, well, does having more platelets, a higher concentration of platelets, help or not? And if you're a young person, if you're under 30, let's say, getting more and more platelets into a smaller volume, or thus a higher concentration, has its benefits up to a certain level, and it's about 5 to 6 times the normal concentration of platelets that's just flowing through your blood. Well, these kits that are used in all the other clinics around the country, they concentrate your platelets somewhere between 1.5 times your normal blood concentration to about 5 or 6 times your blood concentration. By the way, the definition of platelet-rich plasma is that it has to be at least twice the concentration that's normally in your blood. So these standard bedside machines that use these kits, if you're a young person and you have arthritis, or let's say you've got some tendon degeneration in your shoulder, those doses would be effective. The vast majority of patients we see are over the age of 30. And the research has shown that the older the patient is, the higher the concentration of platelets you need to have an effective dose. Also, the higher degree of injury you have, the more platelets you need, or the higher concentration of platelets you need. And so that's why in Regenexx clinics, we customize your dose based on your condition, your own medical comorbidities that may impact how rigorous of a healing environment you have in your body, and your age. Now, platelets are very effective for numerous conditions, but at some point, if someone's arthritis has gotten to a more severe state, that's when we start getting into using bone marrow concentrate, which has much more potent healing abilities, or more growth factors available. And we know that based on the Regenexx outcomes database. We keep track of, okay, if someone has moderate knee arthritis, how well do they do with platelet-rich plasma versus patients with moderate knee arthritis? How well do they do with bone marrow concentrate that has stem cells in it? So we keep track of that, and that helps us decide, are you, the patient, a good candidate for using platelets for your condition, or should we use something more potent, such as bone marrow concentrate? So another thing that we use from the platelets, or a method, I should say, is called platelet lysate. So that's where we get into some of these enriched serum products. So platelet lysate is the treatment where after we've isolated the platelets in the lab, we can then break down the cell walls of the platelets to release all of their growth factors, and then filter out the cell walls themselves, and that leaves us with all of those growth factors, or the growth factor enriched serum. And we use that routinely. I like to think of it as from a medicine mindset, the platelet lysate is like an immediate release medicine, and platelet-rich plasma is like an extended release medicine, because platelet-rich plasma, when we inject it, those growth factors that I mentioned are released after the platelets come in contact with connective tissue. They're released over a course of 7 to 14 days, so it's a slower release, whereas platelet lysate puts them there immediately. And the platelet lysate is what we use to inject around nerves, such as in the back, pinched nerves in the back, or carpal tunnel syndrome, because it provides great nutrition to the nerve. And I previously mentioned A2M, which is an anti-inflammatory cytokine. And to be honest, that's available in Regenexx clinics, but in my personal practice, I don't use it that much, because if I'm using platelets, I like to take advantage of the other cytokines that are with platelets, and thus use platelet-rich plasma. And then I mentioned that the stem cells, the MSCs, they're more potent, and they come from the bone marrow aspiration, from the back of the pelvis in an area called the posterior iliac crest. And similarly to processing platelets, there's a big difference between doing a bedside centrifuge type kit for processing the bone marrow versus in the lab where we very specifically extract specific layers of the bone marrow to get the healing cells. And then with every patient, we quantify that. We count how many total nucleated cells are in your bone marrow. We have cell counters in every lab. And so that is kind of a proxy. It's kind of for how many actual stem cells you have. Because of all the nucleated cells in the healing in the treated in the layers that we extract from the bone marrow, of all the cells, a very small portion are actual stem cells. And there's data that you can use to say, if we want to get an adequate dose of stem cells, we need this much more total nucleated cells, which includes cells like macrophages and hemopoietic stem cells. So there's numerous other cells in the bone marrow that promote healing. In our clinics, every patient that we do this on, we document how many million total nucleated cells are in their treatment. So what can we use this on? Well, knee arthritis is probably one of the biggest things that we use this on. It's, if you look on the Regenexx website, you can pull up a section that says areas or conditions treated, and it'll show how many patients in our registry we're currently tracking. And knee arthritis, we have excellent results on treating knee arthritis, even up to severe arthritis, where it's bone on bone with our more advanced bone marrow techniques, including a technique where we actually inject the bone marrow concentrate into the bone itself, like the pictures I showed earlier. That's called bone augmentation. Even for severe arthritis, we get long-lasting relief. Shoulder, we can treat rotator cuff tears very well, arthritis in the shoulder. Although if someone's got very advanced shoulder arthritis, we consider that to be a poor candidate. But knee, I mentioned ACL tears, we commonly treat. So we're able to help people with severe knee arthritis avoid knee replacement. And these procedures, our goal, like for a knee procedure for severe arthritis, our goal is to give 3 to 7 years of relief. It's usually more like in the 4 to 6 range of patients doing very well. But there are some patients in the registry who are 15 years out and they're still doing well. But you can repeat it. So if someone gets 5 years of relief and their symptoms start coming back, one of the first things I'll recommend is doing a platelet-rich plasma procedure to try to give you a bump in growth factors and buy you more time, sometimes a few years more time. But if patients are seeing their pain return, many patients will do a repeat bone marrow stem cell type procedure. So we have many patients who they know they have mild arthritis and they don't want it to progress to severe arthritis, so they'll do more platelet-rich plasma type injections to help prevent it from progressing. And we see a lot of patients with meniscus tears that we effectively treat. So this is kind of a drawing that shows the back of someone's pelvis. This area here is called the sacrum, and this is the ilium, and this is the crest of the ilium. This is all from the back side. So if you're looking at a statue or a person, you'd see little dimples in here called the dimples of Venus. That's kind of where the posterior iliac crest is. So we extract them from this thick part on the back of the pelvis. In a surgical type procedure, it's all full surgical preparation, surgical drapes, surgical gowns, all sterile technique. But in there you can get progenitor cells and platelets and lymphocytes and granulocytes, all these stem cells, all these different healing cells from the bone marrow. And there's a buffy coat layer and a lipid layer that we extract manually in the lab to extract these cells. So currently tracking 19,000 knee procedures going back as far as 2005, as of I got the date wrong, that should have been as of 1/21. But anyway, so we have a lot of knee procedures that we're tracking, and 38% of the patients will see, or they rate their knee improvement as 38% by 1 month. They generally are seeing 50% improvement by 3 months, and 57% by a year, and 60% improvement by 4 years. And so that gets back to, we look at when we track these outcomes, we are looking at what is your pain level and what is your functionality. So what can you do and what can't you do? And this information is all available on the Regenexx website. So we're tracking it and we're seeing good results. So this is just a slide. I don't want to get into it in detail, but it's data from the Regenexx research study looking at OA as osteoarthritis, looking at how well did patients respond to exercise therapy versus bone marrow injections, and this KL grades 3 to 4, that's moderate to severe. That's a grading for arthritis of the knees, and that's moderate to severe arthritis. So we're able to help many, patients with moderate to severe shoulder arthritis, help them avoid replacement, rotator cuff tears and labral tears. The labrum is a lip of cartilage on this edge of the socket that increases the surface area. And some interesting things, our outcomes database that have found that if you have severe shoulder arthritis, you're considered a poor candidate for a procedure. However, if you got severe arthritis or moderately severe arthritis and rotator cuff problems at the same time, patients actually do better if they've got the rotator cuff problems that we're treating in addition to arthritis. They do better than if you just purely have shoulder arthritis. So I have some theories. I think maybe a lot of the pain is from the rotator cuff problems, but that's just my own theory. But that points out one of the benefits of tracking your data. So we know what conditions we should offer treatments for and which ones we shouldn't. So this here is a diagram on kind of showing the shoulder and an exaggerated drawing of the bursa, and underneath the bursa are the rotator cuff structures. This isn't how we would do it, because, for example, in the drawing, the person has no sterile gloves on or whatever, there's no sterile cover on the ultrasound probe. We use all sterile technique. But anyway, this gives you an idea of where in the shoulder we do percutaneous rotator cuff procedures. And this is data from a Regenexx study showing partial and complete but not retracted tears, meaning you have a complete tear but the tissues are still close to each other, and it shows that we got excellent results and decreased pain. This is an MRI showing a tear of the rotator cuff. All the white here is fluid, and the arrowhead shows where the tear is. So rotator cuff are things that we do have good success with. We're able to treat ACL tears in the knee, but not all. If you have a partial tear or if you have a full thickness tear but it's not retracted, similar to the rotator cuff, we do those do well. There's also there are some specific measurements we take to see how far the shin bone has shifted on the thigh bone, and to give us a better measurement as to whether you're a candidate or not. These are all types of ACL tears that we treat. If you have a full thickness tear and there's no connection between them, that's not something that we would offer treatment on. And this is, we've seen this picture before about the ACL and how there are two different bands of the ACL that we can put injections into. And this shows some before and after, actually. I think it's 12 months separated. No, 6 months. So on the left is the arrowheads show a non-distinct ACL. It should be a dark band that you see. That's a torn ACL. And then on the right, you can see how it's a thick, dark band 6 months later showing healing. So let's talk about some of the hype around stem cells. Because there's a lot of hype out there and a lot of misinformation. And so it's like to think of three ways of thinking how people or clinics or institutions go through implementing new technologies. And the first is kind of, this is a beautiful thing, this is magic, it works for everyone. As people progress and learn more, you might think, well, this is great and it helps almost everybody. And a mature thought process would be, let's figure out who is a good candidate. And that's one thing that we pride ourselves on in Regenexx clinics, is we assess every patient's candidacy individually. And really, we're the ones that are really leading the way on doing this. So I mentioned earlier about amniotic tissue or fetal tissue or cord tissue as stem cell injections, and that is really an embarrassment in the medical field. It's still being done routinely. It's advertised routinely. But the point is, when you take umbilical cord tissue or placenta tissue and then go to and inject that in another person, you have to sterilize it. So there are products that are FDA approved amniotic tissue products. That means they've gone through FDA testing to show that there's no bacteria or damaging tissue in it. And it's regulated as a drug. So clinics can buy bottles of amniotic extract tissue to inject into a patient. The fact that it's approved doesn't mean it's effective. So, and there are so let me back up. So the fact that in order for it to actually be shipped and sent to another patient, it has to be sterilized, meaning all the cells are dead. The cells have been sterilized, so there are no live stem cells in that product. So if you see ads for that, run away, because they're not live injections. There are clinics who have defrauded Medicare, making false claims about these types of injections. And these clinics, Medicare has recently gone back and demanded repayment of all funds that they've paid out for these types of injections. So it's not what we do, and it's not anything that has any good data to show really good efficacy, because there are no live cells in there. Now, people will say, well, but there are growth factors in there, which is true. So there can be healing growth factors in those amniotic or cord tissues. That has been analyzed, not only at the Regenexx research labs, but at least 2 other major institutions in the country. They've looked at how many growth factors are in these products, and there are growth factors in there, but they're less than the number of growth factors that you would get by just drawing blood out of the patient and injecting that blood directly into a patient. So there are growth factors, but they're very low levels. These are often done in chiropractic offices. I personally have a friend who told me years ago he went to a clinic, and a relative of his was able to get the product for only $5 a vial rather than paying $5,000 per vial, and did the injections, and they didn't work, but it wasn't at a physician's office. They usually don't use guidance, like I mentioned, ultrasound or fluoroscopy guidance, and often they're done by a PA or a nurse, and it's just supervised by either a physician or a chiropractor. So I mentioned before, these are dead cell products. They're very expensive, and they're not done by experts in the field, such as in a Regenexx clinic. And I mentioned this has been tested exclusively or intensively, and published studies showing that it's not live tissue. So it is regulated by the FDA, but they're dead tissue products. And that brings up a question. People say, well, are these Regenexx procedures FDA approved? And no, they are not FDA approved, just like having your appendix removed is not FDA approved, because this isn't a drug. It's not considered a drug, and therefore under the purview of the Food and Drug Administration. So if we were to highly manipulate the stem cells and process them and try to grow them and extract them, then the FDA would say that's a drug, and that has to go through multi-million-dollar drug trials, and it isn't. And so when we do a procedure, it's not from the cells that you get, be it platelets or be it bone marrow concentrate. They come from your body. They're taken out either by a blood draw or a bone marrow aspiration that day, processed that day, and re-injected that very same day. So, and those are all some of the things that are necessary to not be considered a drug. We're not sending your cells off to a lab and then processing them and then injecting them in other patients. So the thing I want to emphasize is Regenexx clinics are the world's leaders in regenerative medicine, orthobiologic procedures. We're all highly trained physicians. Not only do Regenexx physicians have a long-standing history of doing these guided procedures before even going through Regenexx training, but all Regenexx physicians and all Regenexx clinics all have go through specific Regenexx training and Regenexx lab processing training, so that no matter where you go for a Regenexx clinic, you should be getting the same type of treatment. The other thing that really is different with a Regenexx type, a Regenexx clinic or an is the level of evaluation that you should get at a Regenexx clinic. So in the past, I've worked in different orthopedic clinics as a non-surgical orthopedic doctor, and I'd see how long of an evaluation the surgeons give to their patients. In a Regenexx clinic, it's a lot different. So if, for example, if you have a knee issue, I will examine your foot and ankle, knee, hip, back, the whole kinetics chain. And when you go to a Regenexx clinic, we expect you to get a very thorough exam. It should be a good 20-25 minutes just for the physical exam portion. Then I spend a great portion of the time talking about your diet, your lifestyle, what supplements you might take, what medicines you take, all different things that we know that can maximize your outcomes to make your healing environment in your body as rich and ready for healing as possible. Because, as I mentioned earlier, these procedures all stimulate your own innate healing. It's not magic pixie dust that you just put it in there and it works. It stimulates your own innate healing. So we spend a good amount of time looking at how can we maximize your healing. What sorts of things can we do to get your body ready before the procedure and after the procedure to promote healing? That might include recommending different supplements there, and I mentioned before that there's a very high-tech research facility at the Regenexx main clinics in Colorado. Well, they've looked at that. They've looked at if you take stem cells, they can culture and expand stem cells in that facility for research purposes. What Regenexx has done is they've looked at taking culture expanded stem cells and then exposing those cells to all different types of supplements to see which supplements on the market actually stimulate stem cell activity, at least in the petri dish, and which medications that patients might be taking affect stem cell activity. So there we have a extensive list of different medications that actually inhibit your stem cell activity. So as part of your evaluation, I would also look at what medicines are you on? Are they ones that we can have your primary care provider switch you out to a different medicine for the short term while you're going through the procedure, based on this research. So we do a very long, thorough evaluation, not just of the joint that you're dealing with, that you're complaining about, or that's affecting you, but also the ones above and below it. And that ties in with our post-procedure approach in that after your procedure, usually 2 or 3 weeks after the procedure is when we get you into physical therapy. And the physical therapy that you get after a Regenexx treatment, is generally way different than physical therapy you might get from other procedures, because we really work hard to work with physical therapists that have the same mindset where they look at your whole structure. If you're treating your knee, they don't just do therapy on the knee, they might be working on your shoulder, your spine, your hips, the whole kinetic chain. So it's a much more holistic approach. Looking at you as a whole person, looking at your diet, looking at your medicines, your supplements that you might take, and your activity levels. For instance, we know that doing things like high intensity interval training can increase your your platelet counts. We know that research has shown that resistance strength training can activate stem cells in your body, or that intermittent fasting can stimulate stem cell activity in your body. So these are all things that we go through and to try to maximize your outcomes. So with that, I'm going to open it up for questions. If anyone has questions, I've put my contact information and the contact information for the Regenexx Des Moines Clinic up. And I encourage you, if you don't have questions now, if you think of questions, you can always email me or give us a call or come on in for an evaluation. So with that, I'd like to thank you for coming. And if you have any questions, it looks like we may have 1 or 2 here on the web form. And if I can get my mouse to cooperate, I'll get over to that. So let's see. We have one question. Says, my mom, age 68, has a rotator cuff tear and was told by your staff that she was not a good candidate for platelet therapy. Would that likely be because she has too much arthritis? And if not PRP, could she still have consultation with you to help understand more about her injury and options? So yes, it could, there could be numerous things. It could be if she had a tear, if the tear is completely ruptured and retracted, if it's a complete rupture, even she would be considered a poor candidate even for a stem cell procedure. If she has low-grade tears of the rotator cuff, like partial thickness, partial width tears, those are things that we can treat with platelets, but higher grade tears, you would not be considered a candidate for a platelet procedure, but for a stem cell bone marrow type procedure. So that could be it. That could be the what it was, but I certainly would recommend coming in for a consultation. When we have a consultation, if the patients have had imaging studies such as an MRI or X-rays, previously, we asked that you get those to us in advance, because I'll look at those images in advance and really analyze it before the patient comes in. Next one is question mark, insurance coverage. Generally, insurance doesn't cover any stem cell or platelet procedures, which is sad because there's more research showing the effectiveness of platelet-rich plasma than there is for steroids or any other procedures. On the bright side, there are currently about 2,000 corporations that will pay for Regenexx only regenerative medicine treatments. Regenexx, I mentioned several times how Regenexx clinics we've been tracking our outcomes, and we have the world's largest orthopedic outcomes database. Based on that and other analysis of that data, Regenexx has been able to approach companies that have self-funded insurance plans where they fund their own insurance, and we've approached self-funded insurance plans saying, look at our data, we've got to look at our outcomes. We think we know we can save you, the corporation, money by avoiding unnecessary surgeries for orthopedic conditions. Would you like to be part of the Regenexx corporate program and therefore offer treatments to your employees if they have a condition that otherwise would need to go to surgery? So maybe 4 years ago, I think there's about 400, maybe 500 corporations, and now it's over 2,000. So at least from that point, in the insurance standpoint, it's rapidly expanding. But from your traditional Blue Cross Blue Shield or Medicare, Medicaid, it's not covered, and patients pay out of pocket. Let's see, another question. You didn't talk about SI joints or L4, L5 improvements. What's your success and what can you do for spine? Regenexx in general has lots of experience with spine and lumbosacral conditions. I personally do a fair number of sacroiliac procedures. Let's see. Let me get into here. I want to say the lumbar spine is probably the second largest structure that Regenexx clinics treat. Would you recommend peer-to-peer stem cell? That I would say we are. It really depends on the patient's condition. How painful is a bone marrow extraction? You're not asleep. You can either use conscious sedation, where we have an IV to make you kind of drowsy, and pain medications, or you can use nitrous oxide and oral medications, but it's surprisingly well tolerated. Patients, I want to say 95% of the patients are surprised at how little they felt, and sorry, the cleaning people are here. How little they felt, and I want to say maybe 1 out of 20 will say, boy, that was painful, and about 1 out of 20 will say, I didn't even notice what you were doing. So in addition to IV medicines, we also numb it up all the way down to the surface of the bone, and it's way different than the horror stories you may have heard from people who've had bone marrow biopsies for cancer treatments, or even, I know that the technique that they use at some of the other major institutions, some very famous ones, they draw that bone marrow out really fast, and that's painful, and we go very slow. So let's see, does it cover any imaging during the evaluation process? Well, yes. So, well, like for when I see a patient for, let's say, their shoulder, I always do an ultrasound examination of that shoulder, or for the knee, that's part of my physical exam. The ultrasound is like, for me, is like a stethoscope to a cardiologist. And people question, can you use flexible spending accounts? I know health savings accounts can be used. Flexible spending accounts might be in the same category, but that's something I would defer to our billing people. But And it might vary, flexible spending accounts might vary based on your plan. And then one patient said she had a PRP with Regenexx in 2021 at age 31, combined with physical therapy, and it had great results. And she always recommends Regenexx, and she would pay out of pocket in a heartbeat because it's a small price to pay. Another question, if we have multiple joints with issues, can you treat more than one at a time? And if not, how do you decide what to do first? Yes, you can treat more than one at a time. I generally treat the ones that either are affecting the patients the most, or if there are some joints that if the arthritis progresses to severe arthritis, you're not considered a good candidate. For example, really severe hip arthritis or end-stage shoulder arthritis is considered a poor, patients are considered poor candidates for that. So there are some joints where I'll encourage patients to try to address that sooner than later to avoid it progressing further. But we'll often treat multiple joints at one time, and then some of the limitations are if we can. The more joints we treat, the more blood we have to draw, or the more bone marrow we have to draw, and we kind of reach a physical limit as to how much you can actually draw from a patient safely for a given procedure. So those are some of the things that come into play, but we routinely do multiple joints. So with that, it looks like I've addressed all the questions. I see someone has her hand up, and it's Sarah. And Sarah, would you like to ask a question? If I can unmute you. No, I'm thinking of someone else. Oh, there. Sorry, it was Carol. Sorry. Okay, Carol, do you have a question?
Oops. Can you hear me?
Yes.
No, you answered it. I do kind of have another one that I thought of, and that was I had a major rotator cuff tear repaired in 2010, and I've been great since, and just within the last year or so, been having some pain. So I had an X-ray, and the surgeon that did the repair said that, oh golly, there's arthritis in there, and shoulder replacement is your next option. And I thought, no, I don't know what is my next option, but it's not that. So how do you determine how much arthritis is in there? Because literally, just since it's the first big snowstorm, it started aching a little bit, but otherwise I didn't have any pain.
So osteoarthritis is kind of a subtracting type condition. It meaning your cartilage is going away, your cartilage is wearing away. So how do you determine how much arthritis you have? The first step is X-ray, and basically you're looking to see how much space is there between the ball and the socket. So X-rays go through soft tissue. They go through cartilage and connective tissue, or like in the knee, they go through the shock absorber called the meniscus. So if you get an X-ray and there's space between the bones, you probably have cartilage there. But you can't prove it, but I mean, you probably do. If you get an X-ray and there's no space, you know there can't be cartilage there. So that's where people say bone on bone arthritis. That means if you get an X-ray and there's no space at all between the bones, that would be severe arthritis. Other things that give us an indication as to how severe your arthritis is do the bones have their normal structure? Like, is the ball still round, or is it getting flattened or lumpy and bumpy, or have spurs and cysts on it? Those are things that we look at to grade how severe your arthritis is. And finally, an MRI, if you get an MRI of the shoulder or an MRI of the knee, the MRI actually can measure how thick the cartilage is. And you can see it. Sometimes you'll have areas where the cartilage is fairly well preserved, but then there might be areas where there's pockets that are completely worn down to bare bone. So MRI shows that. So we start with X-ray, and based on the X-ray, if it's questionable, then or indeterminate, then we will get an MRI.
Okay, thank you.
Uh-huh. All right. And if there, let's see, is it Mel Scott? That's Carol. Okay, well, it looks like that's it for the questions. And like I mentioned, this is recorded. And so it will be available probably later this week. Thank you all for attending, and I hope this was helpful and answered a lot of questions you may have had in your head regarding regenerative medicine stem cell treatments. Thank you for your time, and enjoy the rest of the winter. And and if you live in the Midwest or northern areas like we do, stay warm. So take care and thank you.